Do you know at what age dogs start aging? The onset of aging in dogs varies depending on the breed and individual, but it is generally said to start around 6 to 9 years old for medium and large breeds and around 9 to 11 years old for small breeds. However, factors such as health conditions and genetic factors also play a role, so it may vary for each dog. Not being aware of your dog's aging and continuing to treat them the same as when they were young can tire them out mentally and physically, which can become stressful and shorten their lifespan. Therefore, regular health checkups and careful observation are important. This time, I'll talk about the theme of signs of aging in dogs that are dangerous if you don't know about them. For those who thought it doesn't matter because their dog is still under 6 years old, that's not true at all. Because if you know about aging in advance, you can slow down the speed of aging and notice aging early to take preventive measures against diseases. You can also promptly consult with a veterinarian for early detection of any illness and develop a care plan tailored to each dog's needs. In other words, regardless of your dog's age, this video is useful for all dog owners, so please watch it until the end. Firstly, I'll discuss the important point that dogs have a short lifespan. Naturally, dogs have shorter lifespans than humans. Generally, small breeds tend to live longer than large breeds, but the average lifespan of a dog is about 10 to 15 years. However, some small breeds may live for more than 15 years. Large and giant dog breeds tend to have shorter lifespans due to their size and genetic factors. It is common for many large breeds to live only about 7 to 12 years, but this varies for each individual dog. Dogs age at a rate about 4 times faster than humans. To put it in human terms, 1 day for a dog is approximately equivalent to 7 hours for a human, and they age about 4 years for each human year. Honestly, dogs seem innocent and childlike forever, don't they? However, aging in dogs typically progresses gradually. Therefore, because changes occur little by little every day, owners may not easily notice signs of aging. Additionally, if owners are busy and caught up in daily life, they may not pay attention to their dog's health and behavior, resulting in not noticing the signs of aging. However, without realizing it, dogs are getting older compared to their owners and aging is steadily progressing. Because it can be difficult to notice even when living together, it is important to learn about signs of aging in dogs through this video and change their approach and living environment according to their age as soon as possible. Otherwise, your beloved dog may experience both physical and mental hardships. Additionally, we will provide detailed explanations on methods to delay aging and things to be careful of when living with older dogs. Now let's get to the main topic. The first point is your dog getting fat. I believe there are owners who are worried when their dogs start gaining weight as they age. It's a very concerning issue for owners, isn't it? Have you noticed your beloved dog gaining weight as they age? Due to aging, dogs' metabolism slows down and their activity levels decrease, making weight management challenging. Additionally, if there are health issues such as joint pain or decreased mobility, dogs tend to avoid exercise, which can lead to weight gain. Moreover, the decrease in muscle mass and increase in fat tissue due to aging also contribute. Furthermore, lack of awareness and inadequate management by owners regarding age-related changes and health issues can also cause weight gain. Specific dangers that obesity poses to dogs include cardiovascular diseases, joint diseases, respiratory diseases, skin diseases, strain on the heart, pancreatitis, and diabetes. Overweight dogs have a higher risk of cardiovascular diseases such as hypertension and heart disease. Excess weight puts strain on the heart and may worsen blood pressure and circulatory system function. Additionally, overweight dogs experience increased strain on their joints, leading to a higher risk of joint diseases such as arthritis and cartilage damage. Especially in large breeds, which are more prone to joint stress, the risk of joint diseases due to obesity is higher. Furthermore, overweight dogs may experience decreased lung function, increasing the risk of respiratory diseases. Excess fat can compress the chest cavity, obstructing normal breathing. There is also a possibility of developing rashes or inflammation in the folds of the skin due to difficulty in maintaining excess fat and skin hygiene. The dog's heart plays a crucial role similar to that in humans, pumping blood throughout the body. However, an overweight dog's heart has to work harder, leading to increased stress. As a result, overweight dogs have a higher risk of heart diseases such as heart failure compared to dogs of standard weight. Additionally, overweight dogs are more prone to diabetes. Diabetes occurs when cells cannot adequately absorb sugar from the blood, leading to sustained high blood sugar and urinary sugar levels. Dogs with diabetes have difficulty absorbing nutrients, leading to gradual weakening of the body. For older dogs whose physical strength is already declining, this becomes a significant burden. By now, you should understand the dangers of obesity. Now let's check if your beloved dog is overweight. Try running your fingertips along your dog's rib cage to feel if there is a slight indentation. If you can feel the ribs with a slight indentation, your dog is at an ideal weight. On the other hand, if you can't feel any ribs at all, your dog is overweight. If your dog is overweight, here are some measures you can take. Avoid giving too many treats and provide an appropriate amount of food, take daily walks, and engage in playtime. Avoid giving treats every time your dog begs. Ensure both treats and meals are given in appropriate amounts suitable for your dog. Also, it's important to take your dog for walks twice a day and engage in indoor play with your dog. It's recommended to exercise your dog until they start panting. Regularly measure your dog's weight and compare it to a healthy weight. Consult with a veterinarian to determine your dog's ideal weight range and manage their weight accordingly. If left untreated, obesity poses a high risk to your dog's health, so take action promptly. The second point is decrease in motivation. A decrease in motivation in older dogs is a worrying sign for owners. As dogs age, their bodies gradually change and they may experience physical health issues and psychological impacts. A decrease in motivation is one of these signs, indicating changes in a dog's daily behaviors and interests. Common signs of decreased motivation in older dogs include a reduction in activity levels. They may engage less in activities they used to enjoy, such as walks and playtime, and may spend more time sleeping. Additionally, changes in appetite may be observed. Aging or health issues can lead to a decrease in appetite, causing dogs to no longer enjoy their meals as they did before. Furthermore, a decline in interest is also a sign of decreased motivation. Dogs may show less interest in activities and play they used to enjoy and may not want to participate in those activities anymore. Changes in sociability may also be observed with older dogs who used to enjoy interacting with other dogs or people now avoiding such interactions. A decrease in motivation indicates that older dogs may be suffering from health or psychological issues. Pain, discomfort, stress, and anxiety can all contribute to decreased motivation. Additionally, cognitive issues and psychological problems are also associated with decreased motivation. Addressing a decrease in motivation in older dogs requires diagnosis and appropriate care from a veterinarian. Veterinarians can evaluate the dog's health condition and propose suitable treatments and care. Owners should carefully observe their dog's behavior and health and support the health and happiness of their older dogs through regular consultations with veterinarians. The third point is decrease in exercise. As dogs age, their exercise levels decrease. They gradually become less interested in going for walks and may stop walking soon after starting. One thing that should never be done during such times is forcing your dog to walk. Many owners may feel pressure to walk their dogs excessively due to the belief that walks are essential for their health. However, it's important to note that forcing older dogs to walk excessively can be detrimental. While walks are indeed crucial for maintaining the physical and mental health of older dogs, maintaining the same walk duration as when they were younger can be harsh for them. Instead, provide opportunities for walking and play and engage in light exercises to maintain muscle strength and joint health. Now, let's discuss the appropriate amount of walking for older dogs. For example, walks lasting 30 minutes to 1 hour may be too long for older dogs who tire easily. Personally, I recommend shorter walks of 5 to 10 minutes, several times a day. Allow older dogs to walk at their own pace, and instead of walking long distances, opt for shorter distances multiple times. Also, vary the time and route of each walk to provide new stimuli and efficiently burn calories. Additionally, choose flat routes without steep inclines to avoid putting strain on their legs and joints. It's also important to consider the time of day and temperature. As older dogs have reduced thermoregulatory function, choose cooler times like early morning or evening in summer and daytime when the sun is out in winter to minimize their discomfort. Besides walking, swimming is also recommended as a light exercise. Swimming is low impact for older dogs as the buoyancy of water reduces the load on their joints. Provide opportunities for swimming that older dogs can enjoy, such as in pools, lakes, or the sea. However, ensure safety precautions are taken to allow older dogs to exercise safely in water. The fourth point is lack of response to sounds. In fact, dogs experience hearing loss as they age. This condition is known as presbycusis, which is caused by changes in the internal tissues and nerves of the ears, leading to a decline in the ability to transmit sound signals. If your dog's response seems dull temporarily, it might be due to fatigue or mood, which is not a concern. However, if there is chronic lack of response, it could indicate presbycusis. Signs of presbycusis in older dogs include not responding when called by name, not waking up to loud noises while sleeping, increased anxiety or excitement due to uncertain auditory information, decreased attention to environmental changes due to reduced hearing, leading to unstable walking, and so on. For such hearing-impaired dogs, here are some actions that owners can take. First, approach the dog in a way that they can see you. Never approach from behind and touch, as it may startle your dog, making them wary of you and unable to relax. Also, when interacting or praising, smile and use your body language expressively. Previously, your dog could recognize your gentle voice and understand that they were being praised, but with hearing loss, this may not be the case. Use visual cues such as a smile while gently patting your dog's head to ensure that they can understand through their sight. For instance, when you want to call your dog for meals or walks, wave your hands widely to get their attention. Additionally, it's important to adapt to the indoor environment to maintain stability. For example, laying down mats to soften footstep sounds or installing barricades to prevent your dog from entering hazardous areas in the house can be helpful. If your dog's hearing is severely impaired, visual training is recommended. Hearing-impaired dogs can receive training based on visual stimuli. Using hand gestures or body movements, you can teach your dog to follow commands. By implementing these strategies, you can help your hearing-impaired dog relax and live comfortably without causing them surprise or fear. Furthermore, hearing loss can lead to other significant risks, such as accidents during walks or cognitive decline. Older dogs with impaired hearing may not hear sounds like cars or bicycles during walks, increasing the risk of accidents. Therefore, it's crucial to always check for potential dangers around your dog during walks. The fifth point is increasing white hair in your beloved dog. As your dog ages, have you noticed an increase in white hair? Indeed, similar to humans, dogs also develop more white hair as they grow older. It typically begins around the nose and mouth area, gradually extending to the eyes and throughout the body. This phenomenon of hair turning white is called graying. Like human hair turning gray, a dog's fur also becomes white due to aging and genetic factors. The speed and extent of hair graying vary from one individual to another. Generally, medium-sized and large breeds may develop white hair earlier than small breeds. However, the change in fur color itself is not a health concern. Even when the color of the fur changes, it's essential to focus on the dog's health status and quality of life and provide appropriate care. The change in fur color should be accepted as a natural part of the aging process in dogs. As dogs age, their skin condition may deteriorate, so it's advisable to bathe them every 2 months. However, for senior dogs, prolonged bathing or exposure to a hairdryer can strain their bodies due to decreased muscle and physical strength. Therefore, it's best to keep the bathing time as short as possible to minimize stress on their bodies. The sixth point is whitening of the eyes. Have you ever noticed that your beloved dog's eyes seem to be turning somewhat white as they age? Actually, dogs experience a whitening of the lens in their eyes, known as the crystalline lens, due to aging. Some dogs may start to experience this whitening around the age of 7 or 8. The whitening of the crystalline lens may indicate the possibility of cataracts or nuclear sclerosis. Cataracts occur when the lens of the eye becomes cloudy, leading to opacity in the field of vision, which makes the eyes appear white. On the other hand, nuclear sclerosis is a condition where the center of the lens becomes hard and bluish-white due to aging. Nuclear sclerosis typically does not affect vision, so it is usually monitored over time without requiring treatment. However, since it can be challenging for pet owners to distinguish between cataracts and nuclear sclerosis, it is recommended to have a detailed examination by a veterinarian. While nuclear sclerosis may only require monitoring, cataracts may require surgical intervention in more severe cases, although mild symptoms can sometimes be managed with prescribed eye drops or other treatments recommended by a veterinarian. In this video, we explained 6 signs of aging in dogs, so you should be able to notice your beloved dog's aging early on. However, besides noticing aging, you might also want to know specific measures to prevent it. To delay aging in dogs, it's important for owners to provide appropriate care and attention. First, ensure a healthy diet. Generally, around the age of 7, overall bodily functions, including digestion, begin to decline in dogs. Despite this, continuing to feed adult dog food indefinitely can strain their bodies. Therefore, it's recommended to switch to senior dog food around age 7. Feeding age-appropriate food can slow down the progression of aging and ultimately maintain a healthy body. High-quality nutrition supports the health of older dogs and slows down aging. Additionally, provide adequate exercise to maintain muscle strength and joint flexibility. Regular walks and play have positive effects on the physical and mental health of older dogs. Psychological stimulation is also essential. Activating the brains of older dogs through intellectual training and puzzle games promotes cognitive function. Regular health checkups and vaccinations are important to delay aging. Veterinarians check the health status of older dogs and provide necessary treatment and care. It's also necessary to create an environment where older dogs can live comfortably. Ensure their safety by providing soft beds, warm places, and avoiding stairs or steps. Additionally, provide a stable living environment to reduce stress and anxiety and offer love and a relaxed atmosphere. Don't forget the preventive effect of bonding with your beloved owner. Are you spending time bonding with your dog every day? If not, start doing it every day from today. When bonding, incorporate massages, not just petting, as massages improve blood circulation and metabolism, delaying aging. For specific massage techniques, gently massage your dog's neck in circular motions with the palms of both hands as if holding it. Applying pressure to the muscles from the back of the neck to the shoulders with your fingertips works well. It's recommended to start gently and gradually increase pressure, as applying too much force may cause them to become wary. Massaging the muscles along the spine and the pressure points from the neck to the buttocks can also be beneficial. Practice these 6 methods daily to slow down your beloved dog's aging and ensure they stay healthy and live longer. I sincerely hope that your dogs stay healthy and live a long life. Thank you for watching. If you found this video helpful, please press the like button. See you soon.